Good morning, ladies and gentlemen. Guests here present. Good morning, all. We welcome you to this event. I want to seek your indulgence that will be starting in a few moments. Kindly get yourself a comfortable seat, and we'll be back in a moment. Thank you.
is a beautiful thing.
Ladies and gentlemen, once again, we want to apologize for standing way behind schedule. On behalf of the HPV Consortium of the College of Medicine, University of Ibadan, I want to welcome you to Ibadan once again. And may I crave our indulgence to take our seats. National anthem, the Oyo State anthem, the University of Ibadan anthem, and the College of Medicine, University of Ibadan anthem. Thank you all. Thank you very much. You may please be seated. Ladies and gentlemen, permit me to quickly do a brief recognition of our guests here this morning on this side of the table. And I'll be starting with the Honorable Minister of State for Health and Social Welfare of the Federal Republic of Nigeria. Welcome with me, Dr. Isiaq Adekunle Salako. A round of applause for him. Ladies and gentlemen, as we were at the anthems, our chief host of today came in. Welcome with me, the Vice Chancellor of the Premier University, the first and the best, Professor Kayode Oyebode Adebowale, the Vice Chancellor, University of Ibadan. You are welcome, sir. Ladies and gentlemen, make welcome with me this morning the Honorable Speaker of the Oyo State House of Assembly, as he makes his way in and straight to the high table. Right Honorable Speaker of the Oyo State House of Assembly and Chairman Conference of Speakers and State Legislators of Nigeria, Right Honorable Adebo Ogundoyin. A round of applause for him. Welcome with me also this morning the State Advisory Board Chairman for the Mobile Truck Clinic of the HPV Consortium, Chief Adebisi Adeshola. A round of applause for him. You're welcome, sir. Also welcome with me this morning the Provost of the College of Medicine, University of Ibadan, Professor Temidayo Olusade Ogundiran. A round of applause for him. You're welcome, sir. Welcome with me also this morning our co-host and the director of the foremost teaching hospital in sub-Saharan Africa. Welcome with me the Chief Medical Director, University College Hospital, Professor Jesse Abiodun Otegbayo. A round of applause for him. You are welcome, sir. Welcome with me also this morning a former Minister of Health of the Federal Republic of Nigeria, a former Vice Chancellor, a former Provost of the College of Medicine, retired but actively participating in anything that is positive. Welcome with me, Professor Isaac Folorunsho Adewale. A round of applause for him. You are welcome, sir. Thank you. Welcome with me also this morning one of our very passionate sponsors. In fact, she is the director for at the Center for Global Oncology and the Chief of Cancer Epidemiology and Prevention in the Department of Preventive Medicine, Northwestern University. Professor Li Fanghu. A round of applause for her. Ladies and gentlemen, welcome with me our own, and this is always with smiles, Professor Arulogun. A round of applause, Peter. You are welcome, man. Ladies and gentlemen, we have eminent personalities here in our midst this morning, and I know that if I'm to go through my dignitary list, it will take us the next 2 hours, and by that time the The Honorable Minister and Honorable Speaker might have sent me out of this place by fiat. No politicians, they use executive orders, and I don't want to run foul of any of them this morning. So, ladies and gentlemen, I'll break the introduction in pieces, and I'll take it in batches. So please, pardon me if it has not gotten to you. It will definitely get to you. But may I please request that you put your hands together for yourself for making it into this hall this morning. A round of applause for yourself. So in a very uncharacteristic manner, we are going to skip a lot of people and quickly recognize our very junior people that are in the hall this morning. But we want to appreciate them because they've taken their time to come join us and learn from us. So ladies and gentlemen, I'll allow my co-compare to do the introduction of the schools here present.
Thank you very much. Ladies and gentlemen, can we make welcome Ibadan Municipal Government Grammar School, or J-Igbosu? Thank you very much for coming. Thank you very much. Can we make welcome the International School, Ibadan? International School, Ibadan, are you here? Thank you very much for coming. Thank you very much for coming. Can we make welcome Aberdeen College, University of Ibadan? Thank you very much for coming. Thank you. Can we make welcome Pathfinder College, Ibadan? Pathfinder, are you here? Oh, beautiful. Thank you very much for coming. Can we make welcome the School of Nursing? School of Nursing, are you here? Okay. Thank you very, very much for coming. We really appreciate you. Thank you.
Thank you very much. May I just quickly then, with the same call and the same round of applause, welcome all the principal officers of the University of Ibadan. A round of applause for them. Permit me to also welcome all the principal officers of the College of Medicine, University of Ibadan. A round of applause for them. Also, we have with the Right Honorable Speaker of Oyo State, Honorable Olalere Daoud, a representative of Ibadan Northwest. You are welcome. A round of applause for him. Honorable Babalola Abiodun, a round of applause for him. And Honorable Dada Wole, Chairman of Oyo State Primary Healthcare Board. A round of applause for him. And of course, we have the Executive Secretary of Oyo State Primary Healthcare Board, Dr. Muhyiddin Babatunde Olatunji. A round of applause for him. So, ladies and gentlemen, may I welcome with a big round of applause all heads of department of the College of Medicine and University College Hospital Ibadan. A round of applause for them. Ladies and gentlemen, may we welcome all the team from the Northwestern University. A round of applause for them. You're welcome. Okay, ladies and gentlemen, may I also crave our indulgence once again that we rise as we welcome the Deputy Governor of the Oyo State. Not around. Okay, they said this. Okay, it's not around yet, so we'll introduce him at the appropriate time. Ladies and gentlemen, welcome with me. Okay, let me say this. If you are used to events like this, once the compare are standing up, papers will be coming and coming. May I please ask that the papers be piled up. When we take the break, we'll receive the papers. Thank you. Ladies and gentlemen, welcome with me this morning the medical students of the College of Medicine, University of Ibadan. A round of applause for them. Also welcome with me this morning the Director General, Nigeria Institute for Cancer Research and Treatment, Dr. Usman Aliyu. A round of applause for him. A round of applause. You're welcome, sir. So I want to crave your indulgence. I'll come for more introductions, but we need to speed up because of our time. So ladies and gentlemen, we would have to move quickly to take some goodwill messages. And the first person that will be giving us the goodwill message this morning is none other than our host, the provost of the College of Medicine, University of Ibadan, Professor Temidayo Ogundino. A round of applause for him as he steps up.
The Executive of Oyo State, Engineer Sheyi Makinde, ably represented by the Honorable Speaker of the House of Assembly of Oyo State.
Vice Chancellor said he doesn't want to do his speech now. He called me. Okay.
The Honorable Minister of Health of the Federal Republic of Nigeria, who is here ably represented by Minister of State, Professor Salako, our own Vice Chancellor of the University of Ibadan, the first and the best in the nation, all other members of the high table, distinguished senior colleagues, distinguished members of the audience, on behalf of the College of Medicine, University of Ibadan, it is my pleasure to welcome you all Thank you, sir. I understand that the Minister of Health, the Minister of State is here in his own capacity and not just representing the Minister of Health. Thank you for that correction. All other protocols duly observed. On behalf of the College of Medicine, University of Ibadan, it is my pleasure to welcome you all to this momentous groundbreaking ceremony of the official launch of the HPV Consortium programs, most notably the mobile truck clinic, the molecular laboratory, and administrative offices for this program. We are making history today as we take a bold stride towards bridging the gap in healthcare access and promoting healthy living, particularly in the detection, prevention, and management of HPV-associated cancers and other non-communicable conditions. At the heart of this launch is the mobile truck clinic, a dynamic innovation designed to overcome a long-standing barrier to healthcare, that is access, particularly in underserved and rural populations of the nation. With this mobile platform, we will deliver screening, diagnosis, treatment, and counseling services directly to the doorsteps of those who need them most. This is healthcare on wheels. This initiative, along with the new molecular laboratory and the enabling administrative infrastructure, strengthens our capacity for cutting-edge research, community-driven implementation, and scalable public health interventions. These platforms will also support our ongoing studies on oral PV infection and associated oral and oropharyngeal cancer, HPV-based cancer control, and cervical cancer screening. Your Excellencies and distinguished guests, these moments would not have been possible without your support and leadership. Our international collaborators, the Northwestern University, and our resilient implementation teams. I would like to take a moment to acknowledge the project director, Professor I.O. Moasim Bello, for his hard work and commitment towards birthing this moment. As we unveil these transformative programs today, may this be a call to action and partnership to ensure that no woman, no child, and no man is left behind in the fight against preventable diseases. On behalf of the College of Medicine, I thank you deeply for gracing this occasion. Together, we move forward from vision to impact. Once again, you're all welcome.
Thank you very much, sir. A round of applause for...
Thank you. Thank you very much, sir. Thank you very much, sir, for that wonderful goodwill message. Can we make welcome the Chief Medical Director of the University College Hospital, Ibadan, Professor Jesse Abiodun Otegbayo, for his goodwill message. Can we all clap our hands together for him? Thank you very much, sir.
Good morning. Sometimes where you have an intimidating audience, you suffer what the ENT people may call acute vocal cord paralysis. I've been struggling to keep my vocal cords functioning. The MC or company has beautifully laid down the protocol, but of course there are still a few protocols I have to observe by virtue of being in this office. And one of them is to recognize the Honorable Minister of State for Health and Social Welfare. Thank you for coming, sir. My employer, the Vice Chancellor, Professor Adebowale, MNI, FAS. Yeah, because he can recall me this evening and I have to report in the university by tomorrow morning. But I'm sure he won't do that yet. The Speaker of the House, Oyo State House of Assembly, Honorable Ogundoyi, you're welcome, sir. When he was greeting me this morning, he said, CMD, the popular COVID man. So, but the truth is that my result was just a contaminant. I didn't have COVID. I didn't have headache for 1 second. But my name and position and office was used to, Well, I must also recognize my living ancestors in office. I can see Professor Olatubosun Abiodun Ilesome in the audience. Past members of the board of the University College Hospital, I can see Professor John Olufemi Ogunbiyi. He's very shy, he doesn't want to be recognized. Of course, I have so many others I ought to recognize, but permit me to stop there at this point in time. I must not also forget my principal officers at the University College Hospital. The Director of Administration is here, the Chairman Medical Advisory Committee, the DC Mark, and many other colleagues and friends. It is with a deep sense of commitment to the health and well-being of our people that I accept to be the co-host of this historic and groundbreaking ceremony for the HPV Consortium Mobile Truck Clinic for Cancer Screening and the Molecular Laboratory. Today marks another milestone in our collective quest to strengthen cancer prevention, early detection, and treatment within our communities. The burden of cancers, particularly cervical cancer caused by the human papilloma virus, continues to pose significant challenges to the public in Nigeria and across sub-Saharan Africa. This mobile truck clinic and the molecular laboratory represent our proactive steps towards bridging the gaps in access to quality screening and diagnostic services, especially for women in underserved and hard-to-reach areas. The objectives of the consortium is in tandem with one of the pillars in the agenda of the Coordinating Minister of Health, Professor Mohammed Ali Pate, which is to improve health outcomes in the population. And by that token, the University College Hospital has no choice than to support this project to succeed, and that we shall do. As we break the ground today, we renew our commitment to ensuring that this project will not only bring critical screening services closer to the people, but would also serve as a hub for advanced molecular research, training, and capacity building. It is our hope that this effort will significantly reduce the incidence and mortality rates associated with HPV-related cancers in Nigeria. On behalf of the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, the management, staff, students, and patients of the University College Hospital Ibadan, I express our profound gratitude to our partners, the University of Ibadan, and all collaborating stakeholders in this venture whose unwavering support and vision have made this initiative possible. This partnership exemplifies what can be achieved when academia, healthcare institutions, and development partners unite for a common purpose. I congratulate everyone involved and urge all stakeholders to continue to give their best as we move from vision to reality. Together, we will build a healthier future for our communities. Thank you all, and God bless you.
Thank you very much, sir. A big round of applause for the Chief Medical Director. Before we go on to the next goodwill message, permit me to welcome the man whose efforts have brought all of us here. Please, don't bring papers again now, please. The man whose effort has brought all of us here this morning, the lead for the HPV Consortium. Welcome with me this morning, Professor Imran Mohsin Oludare. Imran Oludare Mohsin Bello. A round of applause for him. And of course, he's here with his wife, who has been a pillar of support for him to be able to do all of this. Welcome with me, Dr. Mrs. Khadijat Mohsin Bello. A round of applause. And of course, this girl is here. Welcome with me, Kauta Mohsin Bello, the daughter. A round of applause for her. Ladies and gentlemen, welcome with me also this morning, Engineer Dr. Rabiu Suleiman, the former Group Executive Director, Nigeria National Petroleum Corporation. A round of applause for him. You're welcome, sir. And welcome with me this morning, students from the Oyo State College of Nursing Science, LA, but a round of applause for them. Welcome with me, the head of nursing, Mrs. T.A. Olufale, the head of nursing, Lead City University, Ibadan. A round of applause for her. Welcome with me, the #1 doctor in Oyo State, politically. The chairman, Nigerian Medical Association, Dr. Happy Adedapo. A round of applause for him. And of course, they made sure that there is a gender balance there too. Welcome with me, the chairman, Medical Women Association of Nigeria, Oyo State, Dr. Wumi Akinlosotu. A round of applause for her. You're welcome.
Thank you very much. So ladies and gentlemen, next on our list now is the goodwill message by the Executive Secretary of the Oyo State Primary Healthcare Board. Let's welcome Dr. Muhyiddin Babatunde Olatunji. Can we please clap our hands together as he comes to take his speech?
I don't want to commit error when you are in a place like this, not to stand protocol on its head. And I've been told several times, saying that you stand on the existing protocol is an aberration. So I will not stand on any protocol. But I will stylishly recognize the Honorable Minister for State, the Speaker of Oyo State House of Assembly, the Chairman Advisory Committee, and the VC. I can pretentiously say I would not miss Ifa Olokun Asorodayo Elerigbin Adewale. He's the teacher of teacher. He's our boss. And my boss and brother, also Otegbayo. And Madam Arulogun, the amiable celebrants, and the provost. Ma, you are duly recognized, ma. And every person on this side, I want to assume that I know the names. So, my chairman, I will not fail to do that. It's a great pleasure to be here this morning. This project is a kind of collaboration between the state and the university. And when we talk so much about the meeting point between the town and the gown, this is a classical example of such. And we are going to move into the communities to be able to take health care service closer to people. And the gateway to do that is through the primary health care service delivery system. And it shows that in the country, the only way we can have a quality health care service delivery is to work in a synergistic manner between the federal, the state, and the local government. And to make sure that the bottom line is for people to have access to care. And you will all agree with me, cervical cancer screening or any form of cancer screening is not a simple thing that any person in the hard-to-reach area can easily have access to. So this innovative approach is going to help the well-being of every citizen of Oyo State, and we are glad that happening for the first time in this country, it happens to be happening in Oyo State. So to that, Dr. Mazibelo, I want to say kudos to you and to your team for what you are going to do. And I can assure you that collectively, the only thing you are going to have is success. And in the next few months, I'm very sure it's going to be scaled up to the 3 local government area of Oyo State, not 4 local government. Thank you, and God bless you.
Can we clap again? Thank you so much for that beautiful, beautiful goodwill message. Thank you very much, sir. We really appreciate it. Can we make welcome the Chairman, State Advisory Committee, Chief BC Adeshola, for his goodwill message. Can we clap our hands together? We can do more, we can do more. Thank you very much. You are.
Your Excellency, the Governor of Oyo State, ably represented, the Speaker of the Oyo State House of Assembly, the Honorable Minister of State for Health and Social Welfare, the Vice Chancellor of the only university in the world, the University of Ibadan, the Provost of the College of Medicine, University of Ibadan, the Chief Medical Director of the University College Hospital, distinguished members of the HPV Consortium, our esteemed visitors from the Northwestern University, Chicago, representatives of the John R. Flanagan Charitable Foundation, USA, our development partners, invited guests, community leaders, ladies and gentlemen. Let me start by congratulating my son, Professor Imran Dare Moasin Bello, for this breakthrough. In this connection, I'd like to also thank his mentors, those on whose towering heights he has been able to patch and to achieve this breakthrough. I want to thank specifically Professor Adewale. And when I say towering height of Professor Adewale, that can only be metaphorical, having regard to his height. It is with the greatest pleasure and a deep sense of responsibility that I join all of you today at this important event, the groundbreaking ceremony of the HEP Consortium Mobile Truck Clinic, Molecular Laboratory and Research Hub. I warmly welcome the Honorable Minister of State for Health and Social Welfare to this occasion. Your presence here is a significant endorsement of the national relevance of this project and a strong demonstration of your ministry's commitment to advancing public health, particularly in cancer prevention and early detection. As we gather here, it's important to reflect on the urgency of addressing the burden of human papillomavirus, HPV, a leading cause of several forms of cancer, most notably cervical, but also oral, anal, penile, vulvar, and vaginal cancers. HPV continues to affect countless lives, especially among undeserved populations with limited access to screening and treatment. The emphasis on prevention, early diagnosis, and health education cannot be overemphasized. I therefore commend the efforts of the Consortium for the visionary leadership in responding to this critical health challenge through a robust interdisciplinary research and community-based intervention. The breadth of the partnership, both local and international, demonstrates an unwavering commitment to ensuring that no one is left behind. I'm deeply honored to be appointed as chairman of the State Advisory Board for the mobile clinic project in our dear state. It is a privilege I do not take lightly, and I look forward to working closely with all stakeholders to ensure the success of this initiative. I'm pleased to introduce the esteemed members of the State Advisory Board who will be working along with me. Barrister Mrs. Adelayo A. Lasisi Oriekun, the member. Chief Nyaju Adegbite, Dr. Bashir Olanrewaju, Dr. Mrs. Ayodele Busari, the Executive Secretary of the Oyo State Primary Health Care Board, representing the state government on the board, and the Project Director of the HPV Consortium. Together, we are committed to providing strategic guidance and facilitating implementation at the grassroots level in the 4 local governments that are to be pivotal: Kajola, Iseyin, Ibadan North, and Ibadan Northeast. As the chairman of this board, I had the honor to perform my first role during the investiture of Her Excellency, the First Lady of Oyo State, as the ambassador for cancer control on Friday, 11th July 2025 by the HPV Consortium. Professor Isaac Adewale and I decorated her on behalf of the consortium in her office, and she promised to be the voice for the cancer prevention and treatment in Oyo State, and indeed for the mobile truck clinic implementation in this, our dear state. Ladies and gentlemen, we are especially encouraged by the strong collaboration with the Oyo State government through the State Primary Healthcare Board. This partnership is a vital ingredient for the success of the mobile truck clinic, and it ensures that the program will be rooted in the realities of our communities. Effective health interventions are most impactful when they are implemented with the support of state and local actors who understand the needs of the people. I would also like to take a moment to express profound appreciation to the John R. Flanagan Charitable Foundation for their extraordinary generosity and support. It's truly remarkable that a foundation based thousands of miles away will choose to invest in the health and well-being of communities they may never meet in person. Their commitment exemplifies the spirit of global solidarity and serves as a reminder that our common humanity transcends borders. As chairman, I pledge to work hand in hand with the HPV Consortium in the College of Medicine, University of Ibadan, University College Hospital, the Oyo State Government, and the State Primary Healthcare Board that this initiative delivers on its promise. The advisory board will also play a pivotal role in engaging communities, mobilizing support, and ensuring transparency and accountability throughout the project's life cycle. At this juncture, I would like to call on the leadership and head departments of the 4 selected local government areas, Kajola, Iseyin, Ibadan North, and Ibadan Northeast, to actively support this initiative. We encourage you to take ownership of this opportunity, mobilize your communities, and ensure that the eligible residents benefit fully from the screening and awareness services that will be provided. We also call on traditional rulers, community leaders, women's groups, and healthcare workers to help champion the cause in their neighborhood. In conclusion, I remain optimistic that this initiative will lead to meaningful health outcomes and serve as a model for other regions. I believe the work we begin today will echo far beyond this hall and reach thousands of lives across our state. On behalf of the State Advisory Board, I reaffirm our full commitment to the success of this program and express our gratitude to all who have thus far contributed to making this day and this vision a reality. I want to thank all of you for your patience and for your listening. Thank you very much.
Thank you very much, sir. Ladies and gentlemen, while the chairman of the board for the mobile truck clinic was at his speech, we received in our midst the chairman of today's occasion. So, ladies and gentlemen, may we rise and give a resounding applause for the chairman of today's occasion, His Excellency, the Executive Governor of Oyo State, Engineer Oluseyi Makinde, FNSC, DSC, GSS, RS, ably represented this morning by His Excellency the Deputy Governor, Barrister Adebayo Lawal. A round of applause for him. You are welcome, sir.
Thank you very much, sir. Thank you very much. So, still on the goodwill messages, we'll be calling on the Director General.
Thank you very much.
Sorry
So
for
we'll
that.
quickly do 1 or 2 goodwill messages now.
Okay, sorry for that. We'll be calling on the Director General of the Nigerian Institute for Cancer Research and Treatment, NICRAT, Dr. Usman Malami Aliyu. Can we all clap our hands as he comes to take his goodwill message? Can we do better, please? Thank you very, very much. You're welcome, sir.
The Executive Governor of Oyo State, ably represented by the Deputy Governor of Oyo State, Dr. Adebayo Lawal, the Honorable Minister for Health, and my boss, Dr. Isiaq Salako, the Vice Chancellor of the prestigious University of Ibadan, Prof. Kayode Oyebode, the Honorable Speaker of the House of Assembly, Oyo State, Right Honorable Adebo Ogundoyin, the State Advisory Chairman of the HPV Truck Clinic, Chief Adebi, sir, the Provost of the University of Ibadan, Prof. Ogundiran, and our co-host, the Chief Medical Director of the prestigious UCH, University College Hospital, Prof. Otegbayo, my very good friend. My teacher and the former minister of the Federal Ministry of Health, Prof. Isaac Adewale, our distinguished researchers in the field of oncology, membership of the press, ladies and gentlemen. It is with great honor and profound appreciation that I join you all today at this groundbreaking ceremony of the Mobile Truck Clinic and Molecular Laboratory of the HPV Consortium here at the University of Ibadan. I bring warm greetings and sincere commendation from the entire management and staff of the National Institute for Cancer Research and Treatment, NICRAT. Let me begin by acknowledging the visionary leadership and the scientific rigor of the HPV Consortium under Prof. Imran Oludare Mohassim Bello and mentorship of Prof. Isaac Folorunsho Adewale. Your work in setting a bold and comprehensive research agenda to promote cancer awareness, drive prevention, and enhance the diagnosis and treatment of human papillomavirus-related cancer is not only timely, but also critical to Nigeria's public health future. The consortium's commitment to investigating the potential carcinogenesis of HPV across multiple anatomic sites is exemplary and deserving of national and international recognition. This event marks more than just the physical foundation of a structure. It signals a transformative shift in our approach to HPV-related cancer research, community-based care, and mobile diagnostics and therapeutic services. The deployment of a mobile clinic and a cutting-edge molecular lab underlines the consortium's resolve to decentralize access and bring life-saving innovations closer to underserved population. At NICRAT, we recognize human papillomavirus as one of the most formidable ongoing threats of our life. This is why we reiterate today our strong commitment to working hand in hand with the HPV Consortium to unravel the science behind the scourge of HPV-associated cancers. We are determined to contribute our institutional strength to develop homegrown, evidence-based strategies that reflect our unique epidemiological, social, and health system context. This partnership is not only a scientific imperative, it is a moral obligation. As an institute, we are committed to being a proactive and strategic part of this collaboration. Together, we can move the needle in HPV prevention, advance our understanding of viral carcinogenesis, and ultimately safeguard generations to come. Once again, I congratulate the leadership of the consortium, the University of Ibadan, the University College Hospital, and Oyo State government including all other stakeholders who have made this groundbreaking project a reality. Thank you and God bless.
Thank you very much, the Director, Nigerian Institute for Cancer Research and Treatment. Actually, I made a mistake earlier. It's Professor Usman Malami Aliyu. Can we clap our hands together again for that? Thank you so much, sir.
Thank you very much. May I invite for his own goodwill message, the Right Honorable Speaker of the Oyo State House of Assembly. A round of applause for him as he steps forward. Right Honorable Adebo Ogundo, a round of applause for him.
Thank you very much. Morning, ladies and gentlemen. Let me start by recognizing the Executive Governor of Oyo State, and if I may add, the best performing governor in the history of Oyo State and in Nigeria. His Excellency, Engineer Seyi Makinde, who is ably represented by the best performing deputy governor in the whole of Nigeria. Is a mentor to a lot of we young politicians. His Excellency Barrister Adebayo Lawal. You are welcome, sir. Also, to be fair, I'm glad to also recognize the best performing Minister of State for Health and Social Welfare, Dr. Isiaq Adikule Salako. My honorable members here present also, representing Ibadan Northwest and Ibadan East, in persons of Honorable Daoud Olalere and Honorable Babalola Abiodun. The reason why they are here is because they are also part of the health family, so I told them to join me. The immediate former Minister of Health, who I refer to as the popular COVID man, as they said. Thank you for coming. The former VC of University of Ibadan, Professor Isaac Folorunsho Adewale. You are welcome. Thank you for hosting us. The chief host, the Vice Chancellor of the University of Ibadan, Professor Kayode Oyebode Adebowale. You are welcome, sir. We share the same name, so whenever I see him, I always remind him. The Chief Medical Director, UCH, Professor Jesse Abiodun Otebayo. The Project Director, Professor Imran Marcin Bello. I've heard so much about you and your wonderful work. You're welcome, sir. Thank you for bringing us all today. Esteemed international collaborators from Northwestern University, USA, you are also welcome. Thank you for supporting. The Executive Secretary of the Primary Healthcare Board, Oyo State, my own dear Egbon, Dr. Muyideen Olatunji. Thank you for the invite, although it was very short notice, but I had to be here. The State Advisory Committee Chairman, Chief BC Adeshola, thank you also for being here. Ladies and gentlemen of the press, the students from the various schools all across Oyo State, you are welcome. I see ISI, they were stiff competition for Vail College back when I was in Vail College. I hope you are keeping it going. And other students here present, students from the medical college also here present, and everybody else, you are all welcome. And before I go into my speech, I have to say that just to give you a slight background, I lost my father when I was 4 years old to sickle cell. I'm even happy that he lived to 51 at the time. That is Adeshe Ogudoyi. And when I got the invites through Dr. Olatunji about this program, I had to read what it was about, and I saw that it had to do with anything cancer related is very sensitive and very important to me because I also lost my mom about 2 years ago to cancer. So you can imagine that I'm a child of circumstance when it comes to health-related issues. So anything that the health family is doing to advance healthcare service to the general public, you can bet that I will definitely be there to support it. And that is why it is with great honor and a deep sense of responsibility that I stand before you here today at this historic occasion, not just as the Speaker of your State House of Assembly, but also as a young Nigerian who believes in the public health must rise from the pages of policy to the hands of real people, which is one of the reasons why we're here today. As someone who assumed the position at the age of 32, I've always been guided by a simple conviction that leadership decisions should be informed by the realities and challenges faced by the undeserved in the communities. Today's groundbreaking ceremony is one that speaks directly to that conviction. This event marks a critical step forward in our collective battle against HPV-related diseases and represents a bold vision for accessible, equitable, and community-centered healthcare. Permit me to begin by congratulating the HPV Consortium, ably led by Professor Imran Mohsen Bello, for this groundbreaking initiative. Your multidisciplinary research model spanning clinical and basic medical sciences, dentistry, nursing, public health, social sciences, and humanities reflects the kind of synergy we need to address the complex nature of public health challenges, particularly those posed by the human papillomavirus and its associated cancer. As someone who has championed youth-driven policies and prioritized budgetary support for education, innovation, and health, I find this model inspiring. It mirrors the type of collaborative and multi-sectorial thinking we need in government, and I commend your strategic alliance with global institutions such as the Northwestern University, USA, the London School of Hygiene and Tropical Medicine, UK, and various African and Nigerian health research centers. This is testament to the power of North-South partnership in delivering life-saving innovation. Indeed, the launch of this mobile truck clinic, supported by John R. Flanagan Charitable Foundation, and commissioning of this new molecular laboratory are not just milestones, they are revolution in the fight against preventable cancer in Nigeria and Africa at large. Why does this matter? It matters because as Speaker of your State House of Assembly, I am constantly reminded that effective governance is measured not only by economic growth or infrastructure, but also how well we protect the most vulnerable in our communities, especially women, girls, and undeserved population. HPV is a silent threat. It disproportionately affects women, causing nearly all cases of cervical cancer. As I explained earlier, I lost my mom to cancer roughly 2 years ago, an entirely preventable disease with timely screening and vaccination. Yet, many of our rural communities are unaware, untested, and untreated. This initiative promises to change that narrative. By targeting 50,000 to 60,000 people in the first phase across 4 local government areas of Oyo State, the mobile truck clinic is bringing healthcare directly to the people, especially at the grassroots. It will not only screen for cervical and anal or oral cancers, but also breast and prostate cancers, as well as chronic diseases like diabetes and hypertension. I wish that they included a local government in the Barakpa zone to that. Okay, I have a doctor's word that he's going to include that in it next. What is the role of the legislature in advancing this vision? The Oyo State House of Assembly fully recognizes the role of science, data, and innovation in policy making. We are committed to ensuring that legislative support aligns with advancements in public health. To that end, I will make the following pledges. with the leave of the members here present and also myself, that the legislature will support cancer prevention and HPV awareness. We will do so. We will explore the possibilities of passing a resolution mandating routine HPV vaccination for eligible age groups in public schools. And this will be in line with WHO recommendations. We will also support awareness programs in partnership with our ministries of education and health. Cancer should not be a death sentence. We don't believe that. The budgetary support for public health innovation is also something that the Oyo State House of Assembly is also prepared to do. We will advocate for special budget lines dedicated to supporting communities' outreach programs, such as the mobile truck clinic. These funds will strengthen local implementation in the LGAs, ensuring sustainability beyond the pilot phase. Because we understand this is the pilot phase, but we need to take it beyond that. We're also very interested in institutionalizing the partnership and oversight functions. The legislature will work with the Oyo State Primary Healthcare Board and the Consortium to establish formal mechanisms of oversight and accountability, ensuring that mobile screening programs are regularly evaluated, and adapted based on real-time data. We also intend to engage the youth on health literacy. Through our youth parliament, as soon as is inaugurated, we intend to support the sensitization-driven projects in schools and communities. Information is power, and we must ensure that our people with knowledge are to make informed health decisions. We also have to sponsor a bill, if at least in any case, with the cooperation and collaboration with the health family. The caliber of people that we have here today, I'm sure if we work closely with them, we'll be able to come up with a one-stop shop bill that will consider introducing a bill on comprehensive cancer control in Oyo State. I think it's possible. I think with the political will and with the the kind of caliber of people we have here, we could do it. This law could provide a legal framework for screening, research, data collection, and patient support systems across the state. What is the call to action? Ladies and gentlemen, as we flag off this mobile truck clinic and open the doors of the new molecular laboratory, we are not just inaugurating infrastructure, we are opening pathways to healthier futures. It is not just a ceremony, but a call to conscience. Let this be a clarion call to all arms of government, development partners, civil society, and the private sector. The fight against HPV-related cancers must be collective, sustained, and must be bold. We must support our researchers, our frontline health workers, our women and girls, and the thousands of citizens in Oyo State whose lives can be saved through detection and prevention. We must speak with one voice and act with one purpose. Let's not rest until preventive screening becomes a norm, not a privilege. Let us commit to a future where healthcare meets people where they are. In conclusion, on behalf of the Oyo State House of Assembly, I once again commend the HPV Consortium for your visionary leadership and express our gratitude to the University of Ibadan and UCH for your long-standing commitment to public health advancement. To our international partners, thank you for choosing Oyo State as the site of transformative impact. We look forward to sustained collaboration. And to all the stakeholders gathered here today, let this event be the beginning of a new chapter where no citizen is left behind in the fight against preventable disease. Together we can and we will build a healthier, stronger Oyo State. Thank you and God bless you all.
Thank you, sir. A big round of applause for the Right Honorable Speaker and indeed for all members of the House of Assembly. A round of applause. Thank you very much. Ladies and gentlemen, our time is a bit fast spent, so we are going to rush through what is left now. Today, I have the privilege of calling to give his address the Honorable Minister for Education, And I'm happy that a one-time returning officer and a vice chancellor of a premier institution is seated in our midst this morning, acting fully as a minister of education. Ladies and gentlemen, welcome with me the Honorable Minister of Education, Dr. Maruf Tunja Lausa, ably represented by the Vice Chancellor of the University of Ibadan, Professor Kayode Oyebode Adebowale FAS. A round of applause for him.
Distinguished ladies and gentlemen, I have a mouth of the Honorable Minister, and he has also lent me part of his heart. I can carry the title of His Excellency for just few minutes. Then thereafter, I will return back to status quo. Distinguished ladies and gentlemen, first permit me to lean on the protocols that have been established. But let me just make very few recognitions. The Executive Governor of Oyo State, Engineer Seyi Makinde, Fellow of the Nigerian Society of Engineers, who is ably represented by the Honorable Deputy Governor, Barrister Bayo Lawal, a great alumnus of this university. The Honorable Minister of Health, who is also ably represented by the Minister of State for Health, Dr. Kunle Salako, Chief BC Adeshola. When I came in, you will see that he has a lapel very close to. He asked me where my lapel is. And usually, when you are an MNI and you don't carry your lapel, you're expected to pay a fine of 1 million naira. So I was telling him that even my entire savings is not up to 1 million naira. You see my dilemma. You are most welcome, sir. The 11th Vice Chancellor of this university, Professor I.F. Adewale, and former Minister of Health of the Federal Republic of Nigeria. The Speaker of the Oyo State House of Assembly, Honorable Adebowale, his own first name is my surname. Honorable Adebowale Ogundoyin, you are most welcome. The Chief Medical Director of the University College Hospital, the Provost of the College of Medicine, all our living ancestors. Oh, let me recognize Professor Yinka Aderito, the former Deputy Vice Chancellor Academic of this university. All our living ancestors that are present here, it is good for us to continue to appreciate them because they are the ones that they've gone before us. And we can still, when we still see them around, you know, it excites us. Egbon, I greet you. The Vice Chancellor of Christland University, I think she just stepped out. Professor O.S. Arulogun. Our esteemed principal investigators that are present here, members of the HPV Consortium, distinguished researchers, academics and scholars, captains of industries, and development partners that are present, the students of high schools that are present here, students of the medical college, gentlemen of the press, distinguished ladies and gentlemen. It's a privilege for me to be here, and I see it as a duty to come here.
I will just say a few words concerning Professor Mohasin Bello. Just permit me to just say just very few words. I was Deputy Vice Chancellor Administration when he was conducting his research. Okay, I was told here that the Honorable Minister of State for Health is here. So the implication is that he is carrying also 2 caps. You are most welcome, sir. When he was conducting his research, there was opportunity for intervention to support that research from revitalization funds or needs assessment. And when you see the amount of money that is allocated, it's not as if it's not big, and it is meant for a number of people. So when the support came, and based on his research, we allocated quite a large proportion of that to him. There were criticism in all areas, but I had always believed that if you have interventions like that, and what you are supposed to do is very clear, and even though even at that time we could not estimate the impact that it will make, that it is good to produce one that is full and complete than to produce people in bits that perhaps we may not even see the impact. I think we are seeing the results today because I know we are gathered here because of him. So Professor Mohasin Bello, continue the good works. I have the speech here, so let me quickly go through it. The speech of the Honorable Minister for Education, His Excellency Dr. Maruf Tunji Alausa. It is with immense pleasure and profound optimism that I stand here today at this great citadel of learning, the University of Ibadan, to participate in the groundbreaking ceremony of a truly transformative project, the Mobile Truck Clinic and Molecular Laboratory for HPV Consortium. This occasion is not merely about laying a foundation. It is about laying a cornerstone for a healthier future for Nigerians, particularly Nigerian women, and a more robust pathway for translating academic excellence into tangible national development. The Nigeria's tertiary institutions, particularly our universities, are reservoirs of immense intellectual capital. For decades, they have generated knowledge, they have published papers, and they have trained generations of professionals. Yet, the critical question we must continually ask is, how does this knowledge directly impact lives of our citizens and fuel the engine of our national progress? This is the essence of translational research. The vital bridge connecting the laboratory bench to the patient's bedside, the research finding to the farmer's field, the technological innovation to the marketplace. Translational research is not a luxury. It is an urgent necessity for Nigeria. We face complex challenges, disease burdens, like cervical cancer, driven by HPV, maternal mortality, infectious diseases, food insecurity, environmental degradation, and infrastructural deficits. Solutions to this problem demand more than isolated discoveries. They demand research consciously designed to move rapidly and effectively into application, policy, and practice. Our universities, polytechnics, colleges of education are uniquely positioned to be the engines of translation and consequently for national development. Here is how. 1, problem-centered research. Projects like the HPV Consortium initiative exemplifies what we need. It starts with a critical national health problem, cervical cancer, a leading cause of cancer death among Nigerian women. It leverages university expertise in virology, oncology, public health, and engineering. Critically, it designs a solution, a mobile clinic and laboratory specifically aimed at overcoming barriers to screening and diagnosis. This is research with clear applied purpose from inception. 2, human capital development. Tertiary education, they train the next generation of scientists, of engineers, of doctors, of entrepreneurs, and policymakers. By embedding translational skills, interdisciplinary collaboration, problem solving, innovation management, community engagement, and entrepreneurship into curricula and research projects, we produce graduates that is equipped or that are equipped to drive development, not just participate in it. This project will train vital personnel in advanced molecular diagnostics and mobile healthcare delivery. 3, innovation hubs and technology transfer. Universities must become vibrant hubs where research will spark innovation and commercialization. This requires the strengthening of technology transfer offices, fostering university industry partnerships, and creating supportive ecosystem for startups born from research. The technologies and models developed here, like the mobile molecular diagnostics, have potential far beyond HPV. 4th, evidence-based policy. Rigorous research provides the evidence base for effective national policies. Our universities must actively engage with government at all levels, translating research findings into actionable recommendations for health policy, for agricultural extension, for educational reform, for environmental regulation and economic planning. The data that is generated from this mobile lab will no doubt be invaluable for shaping national cervical cancer prevention strategies. Number 5, community engagement and impact. True translation means engaging directly with communities that we serve. The mobile clinic embodies that principle, taking advanced diagnostics to the people who really need it most in their localities. Universities must break down walls and see communities as partners, not just as research subjects, ensuring that solutions are culturally appropriate and also sustainable. To the HPV Consortium, which I see as a beacon of hope, I believe that this groundbreaking ceremony today is a powerful symbol of what Nigeria's tertiary institutions can achieve. HPV Consortium that is spearheaded by the University of Ibadan represent the ideal synergy. Ideal synergy in addressing a critical health challenge, targeting the elimination of vaccine-preventable cancers. Also, innovative solutions. A mobile truck clinic and mobile lab dramatically expand access to life-saving screening and diagnosis, overcoming geographical and infrastructural limitations. Also, it also brings collaboration, bringing together multidisciplinary expertise within UI and also beyond. There is also the potential for scale and replication. The model will revolutionize not only cervical cancer screening, but also the delivery of other essential diagnostics and primary healthcare services nationwide. The next question is, what is the role of government? The Federal Ministry of Education, under the leadership of the minister, is committed to fostering an environment where translational research thrives. First, by prioritizing funding. We will continue to advocate for strategically direct increased funding through TED Fund, through NRF, and other interventions towards research with clear translational pathways and potential for high societal impact. Projects like these are exemplary. Two, in terms of policy framework, we are reviewing policies to incentivize translational research, interdisciplinary collaboration, university-industry linkages, and intellectual property protection that benefits both innovators and also the nation. Thirdly, in terms of infrastructure support, investment in modern laboratories, in equipment, in digital infrastructure within our tertiary institution will remain a priority to be able to enable cutting-edge research. Fourthly, building capacity. We will continue to support programs to train academics and students in translational research methodologies, in innovation management and entrepreneurship. And finally, recognizing impact. We will champion new metrics for evaluating universities' performance that place the significant weight on research impact, on innovation and contribution to solving societal problems alongside traditional academic publications. To our universities, I urge you to embrace this translational mandate wholeheartedly. Foster interdisciplinary research centers, strengthen industry participation, empower your technology transfer offices, engage community proactively, and celebrate applied innovation as vigorously as theoretical breakthroughs. To our researchers, be audacious in tackling Nigeria's problems. Seek collaboration beyond your discipline. Think about the how of implementing your findings as much as the what. Engage with policymakers and industry. Finally, to industry and development partners, deepen your collaboration with universities. Invest in research and development partnership. Provide expertise, market insights, and pathways to scale promising innovation like the model that will be launched today. Distinguished ladies and gentlemen, in conclusion, the turning of the sword today for this mobile track clinic and molecular laboratory is more than a construction milestone. It is a declaration that the University of Ibadan and the Nigerian tertiary education is committed to translating knowledge into action. It is a declaration that we will not rest while preventable diseases like cervical cancer and all associated cancers claim the lives of our mothers, our sisters, our daughters, and also Nigerians. It is a declaration that our university are not just ivory towers, but dynamic engines powering Nigeria's journey towards health, prosperity, and sustainable development. This project embodies hope. Hope for countless women who will benefit from the accessible screening. Hope for a future that is free of cervical cancer and all the associated cancers. Hope for a Nigeria where its world-class intellect delivers world-class solutions to its people. Let us build this facility with speed and precision. Let us operationalize it with dedication. Let the wheels carry not just the equipment, but the promise of a healthier, brighter future for all Nigerians. Congratulations, the University of Ibadan. The HPV Consortium and all the partners that are involved in this process. May this initiative inspire many more across the nation. Honorable Minister of Education, His Excellency Dr. Maruf Tuji Alausa.
Thank you, Honorable Minister, sir. Another round of applause for the Honorable Minister, as represented by my Vice Chancellor here. Ladies and gentlemen, shall we welcome with a round of applause the Chairman, Medical and Dental Consultants Association of Nigeria UCH Branch, Dr. Akonde, ably represented by Dr. GT. A round of applause for him. Welcome with me also the Chairman, Oyo State House Committee on Health, Oyo State House of Assembly, Honorable Saminu Gbadamosi. A round of applause for him. Welcome with me the Chairman, ICANN, Ibadan, and members of the district. A round of applause for them. And welcome with me His Highness, His Royal Highness, Oba Joel Olaniyi Oyatoye, the Oloro of Oro Kingdom, Kwara State. You are welcome, sir. Ladies and gentlemen, permit me to also welcome to the microphone this afternoon, as she'll be moderating the very short symposium that we want to have now. It won't take us more than 5 to 10 minutes because of our time. The moderator is a Vice Chancellor, so I know she knows how to handle us. Welcome with me our own Professor O.S. Arulogun, the Vice Chancellor, Chrisland University, as she moderates the symposium this morning. A round of applause for her.
Excellency, Governor of the State, ably represented by the Deputy Governor, all other courtesies duly extended, distinguished ladies and gentlemen, partners in progress, advocates of hope, and guardians of our public health. Today, we gather not just to break ground, but to break cycles of delay, of disease, and disparity. This is more than just a ceremony of groundbreaking, but it's a declaration that health must travel, that science must reach, and that no community should be too far, too remote, or too forgotten to matter. And we stand at the confluence of innovation and compassion. With the launch of this mobile truck clinic and molecular laboratory, the HPV Consortium is writing a bold new chapter, one where diagnostics are driven not just by machines, but by mission, where care is no longer confined to the walls of the hospital, but carried on wheels. This symposium session is our platform to spotlight the minds and the hearts behind this groundbreaking initiative. This initiative started many years ago. As I sat there, Professor Adewale was introduced as Ifa. Ifa is the oracle. And as I sat down there, he told me and said, it is not a coincidence that you are moderating this, because I was part of the initiative like 25 years ago. We started as Operation Stop Cervical Cancer. And so in the next few minutes, we'll journey through the stories of science and service, policy and practice, challenge and triumph. We are going to hear the insights, because those who are going to discuss with us today are the founding blocks of the consortium. And to do justice to that, we have Professor Robert Murphy. He's not physically present, but his presentation has been recorded. We have Professor Lifang Hu and Professor Isaac Adewale. I invite you to listen with both ears and hearts, because what we discuss today may inform not only programs, but purpose. And so let's begin. And our first speaker, are we ready with the, okay. Okay, okay. I'm told that the recording didn't come in time to meet this meeting. So we are going to start with Professor Lifang Hu. Okay. So we are going to start with Professor Lifang Hu, the Yorubas have a saying that when a bird wants to fly, the bird does not fly with one hand. And so Professor Murphy is not here, but the second hand is here. And the second hand is Professor Hu.
Hello, everyone. It's such an honor to be here with you all and to share this moment. And I want to say that I'm deeply grateful to stand along with this dedicated group of the leaders, physicians, researchers, and also our advocates and the public health professionals. So I'm Li Fanghao. I lead the Center for Global Oncology at Northwestern in US.
Okay, thank you very much. Professor Adewale will also speak for some 5 minutes, then we hit the ground running.
Thank you so much, Professor Arulogun. Your Excellencies, the Executive Governor, ably represented by the Deputy Governor, my brother, the Minister of State for Health, Dr. Salako, Right Honorable Speaker, distinguished ladies and gentlemen. Today is a unique occasion in the sense that we are actualizing a dream spanning the last 25 years. And credit must go to quite a number of people who contributed to the actualization of what we are celebrating today. One of them is Professor Rob Murphy, who unfortunately had to leave this morning because of some challenges with his flight schedule. He recorded his interview 2 days ago, and I hope we'll be able to play it. But if not, it will be on the website of the consortium. The whole essence of the relationship started with the HIV program when Harvard School of Public Health won their biggest grant of $25 million US 25 years ago. And that led to many other things. And as stated by Professor Arulogun, gave back to a few other initiatives. We started the Operation Stop Cervical Cancer program through a generous donation of $1 million US from the ExxonMobil Foundation. And we set up 6 centers of excellence in Ibadan, Port Harcourt, Jos, Zaria, Lagos, and Enugu. And we're quite happy. We lost one of the principal investigators then through the ADC crash, Dr. Deborah Agai. She died in that air crash. May her soul continue to rest in peace. But then the other centers are still functioning. And so what we are celebrating is the continuation of that initiative. And the beauty of it is that we move from HIV to HIV-associated cancers, and cervical cancer plays a major role when we talk about HIV-associated cancer, because an individual with HIV is 6 times prone to developing cervical cancer. So we veered into looking into the causative agent, which is HPV, and today we are commissioning a one-stop shop completely dedicated to HPV research. And I must thank Professor Marcin Bello, who is now the lead person in this consortium. He's our project director, and he has kept the flag fly. Thank you.
Thank you very much. So, Professor Hu, the question to you, what inspired this collaboration? Professor Adewale had given us how it started from our end, but how did it start from your end?
So as Professor Isaac mentioned, the partnership between Northwestern and the University of Ibadan started decades ago. And built upon this long-standing partnership, I started my cancer research collaboration journey with Professor Imran and Professor Isaac. When I was brought to meet with Professor Imran, so I was looking for a long-term collaborator in HIV research. So because as a cancer researcher, I have always have this dream to do cancer prevention in countries, in populations that need most. So Nigeria has been, in my mind, has been part of my dream because I have heard a lot from my Northwestern collaborators and my colleagues. So after I started this collaboration a few years ago, we have been built a lot of, we have achieved so much by publishing more than 80 publications, and we have formed this HIV consortium, not only focused on cervical cancer, but also other HIV-associated cancers, including oral cancer and also anal cancer. We have secured 2 large NIH-funded programs, and also because the communication, I understand what the population or individuals who live in underserved communities need, because the lack of the screening when they are diagnosed with cancers, most of them are already at a very late stage. So we understand the importance of the screening and also the intervention of those who are at risk. That means they are having HIV infections. We started to develop the mobile clinic, and we want to have the real reach to the communities and also the women who live in those communities. And that has brought us here. We have also brought up many junior scientists, also physicians, to make them take over that we have been developing, we have to do in the future, so they can continue our efforts and to make our dreams realized.
Thank you very much. Sorry. My next question goes to Professor Adewale, and I'm speaking from the voice of public health. We know that one of the challenges with HPV screening has to do with the procedure, the process. So, sir, how do you tackle stigma and encourage testing uptake? Because the essence of the mobile clinic is to take it to the people. But it's possible to have it by my doorstep and I'll not go there. So from the public health perspective, how do we encourage testing uptake and reduce stigma, sir?
Thank you so much. I think the journey has to start from the classroom. When we were growing up in the medical school, we were taught that cervical cancer is a disease of people with multiple sexual partners, people who have many children. The stigma had to do with people who were promiscuous. But then, this was also reimbursed by some of the earlier work by Italian scholars who did autopsy studies and could not find cervical cancer among nuns. So the relationship between sexual intercourse and cervical cancer was long established. But then it took several years before the actual cause of this problem was discovered to be a virus, human papilloma virus. And we now know that having cervical cancer is not related to your sexual occupation, is not related to whether you have many partners or not. It doesn't really matter whether you had sexual intercourse very early, but we know it's related to your ability to clear the virus. This virus is almost everywhere. It's a common sexually transmitted infection. And almost every woman who acquired the infection once they start sexual intercourse. And we know that within 2 years, majority of them will clear the virus. Only those who are unable to clear the virus will then go on to develop cervical cancer in future. And it's going to be a small minority. So the narrative has changed from all those stigma-associated terminologies to looking at inability to clear the virus. And this could be due to several reasons. And for the mobile clinic, we are not going to go out and say, we want to screen your genital tract. No, we are going to offer you a medical examination. We are not just going to confine ourselves to looking at cervix. We are going to check your blood pressure. We are going to look at your urine. So it's a total package. So screening for HPV will just be one of the things we are going to look for. And this will eliminate stigma. Thank you.
Thank you very much, sir. So we've been told it's a one-stop shop that does not only HPV screening, but other medical screening as well. Professor Hu, back to you. What unique innovation is embedded in this? Unique innovation.
Yes, so the HPV screening that has been there many years, but why in countries like Nigeria, and we are not doing screening large scale at the population level? And one obstacle is the technology we are using, because many technologies, they are expensive, and in many ways, in buying equipment, and most importantly, consumables, means each test. And then this hinders women who don't have, who have the financial hardships or have the social or cultural barriers. They cannot come to the clinic to do the regular, to have the regular care. So our innovation together, we have been working with, experience working with many companies that provide this test. So we found the technology that is really affordable, yet accurate, and also portable, more access by the women who have not been well screened, or who have never had been screened. There's one innovation. The second innovation I think we have is we understand the barriers and the needs, and more importantly, the facilitators in Nigeria society. So to understand that, so that will help us to tailor our strategies, approaches, to have more women to have access to the screening. And once we screen them, we are also going to follow up them to do effective interventions. This will be great help to help reduce the burden of Nigeria public health. Thank you.
Thank you very much, Professor. From what our discussants have said, they've talked about how this would improve screening at the community level, and how they are working with policy influencers, because we need to back this up with policy to ensure it's sustained. And for our future, the young ladies who are seated from secondary schools, We've been told that this is preventive, is to ensure that you have a healthy adulthood, that you can navigate life in good health without coming down with disease. And so the essence of all of this is for us to prevent and make sure that we don't come down with the disease, because it's cheaper, more economical than having to treat the disease itself. And as I round off, I want to ask just one more question, and the question goes to Professor Adewale. How does this initiative align with the Nigeria's national cancer control strategy?
That's an interesting one, thank you. I think this setting, to me, is a manifestation of the National Cancer Control Set, with the presence of the Minister of State for Health, who is in charge of cancer control. His presence here, to me, signifies national endorsement. I want to thank the Honorable Minister of State for being here, and he did not even blink an eye before accepting a kind invitation. Thank you, sir, for your presence. Again, the presence of the Director General of NICRAT is also another testimony. And I also want to say that two of us, myself and Professor Marcin Bello, are members of the National Task Force on Cervical Cancer Elimination in Nigeria. So we are embedded in the national program, and we are not going to do anything that conflicts with the national program. We will run with the national program, and whatever we do will be in conformity. Thank you.
Thank you very much, sir. And I'm going to round up this session with an African proverb that says, when the roots are deep, there's no reason to fear the wind. The roots of the mobile clinic is deeply embedded with the national strategy, and so there's no fear of the wind. Thank you very much.
Thank you very much, Ma, for an excellent session. Ladies and gentlemen, you agree with me that that gives a lot of information about what we are in for with the mobile truck clinic. So once again, a big round of applause for our discussants. And I will call my co-compare to
behalf of the Consortium, myself and Professor Adewale would like to say to you that this is presented to you in recognition of your exemplary leadership and commitment to health as ambassador for cancer control.
Thank you so much.
In addition to that, you have this certificate now.
So officially I'm recognized as what?
Ambassador.
Please come closer. And thank you, our lawyer.
Thank you very much, media, for that. So, ladies and gentlemen, it's time to hear the keynote address for today's occasion. And I'll be requesting Ms. Busaya Tofu to read the citation of our speaker.
Thank you very much. Honorable Minister, sir, can you please rise as I cite it in? Please, sir. Thank you very much. Dr. Isiak Adekunle Salako is a medical practitioner who currently serves as the Minister of State for Health and Social Welfare. He received his primary education at the United Primary School, Ayetoro, then proceeded to Abeokuta Grammar School for his secondary education. He holds an MBBS degree from the University of Lagos and Masters in Public Health from the Lagos State University. He has extensive experience in public health, especially in health policy and management. He serves as the Ogun State Commissioner for Agriculture, Housing and Health between 2007 and 2011. In 2020, he was appointed as the chairman of the Ogun State Hospitals Management Board and was adjourned the best government parastatal chairman in the state in 2021 by Gateway News magazine. Wow. In August 2023, he was nominated by President Bola Ahmed Tinubu to serve as a minister, and after a successful screening by the Nigerian Senate, he was appointed.
Please, let's be seated. His Excellency, the Governor of Oyo State, here ably represented by His Excellency, the Deputy Governor, Barrister Adebayo Lawal, the Honorable Minister for Education, my colleague, who is also represented here, the Speaker, and should I say the health-friendly Speaker of the Oyo State House of Assembly, who is the only person, whenever he's present, that is allowed to speak. All of us can talk. When the Speaker is around, he's the only person who can speak. Right Honorable Adebo Ogundoyin, Vice Chancellor of the University of Ibadan, the parents of this College of Medicine, our host, the Provost, and of course the co-host with the CMD of the Teaching Hospital, Professor Otegbayo. Let me especially recognize the former Minister of Health, Professor Isaac Adewale, who I will describe as a he for she, leading nationally and internationally this movement to eliminate a disease of women from the Nigerian states. Thank you for the work you are doing, sir. The Director General of NICRAT, our agency that is in charge of cancer prevention, cancer treatment, and cancer control, Professor Malami, and all other officials from the Federal Ministry of Health and Social Welfare here present. Permit me to recognize all the top government officials of Oyo State, especially our members of the House of Assembly who are here present, and of course, the Executive Secretary of the Primary Healthcare Development Agency for Oyo State. Let me recognize the HPV Consortium, all members of this very important consortium, and I use the project director, Professor Imran, as a point of contact for all members of that consortium. Our traditional leaders, our students, medical students, nursing students, and our greater tomorrows, great Nigerian students, gentlemen of the press, distinguished ladies and gentlemen. Well, first let me say that the Nigerian health system is one, and at ministerial level, myself and Professor Pate, we are one. So anytime you see me, you can be rest assured that you have also seen Professor Pate. But in order to put the record straight, I am not sure whether Professor Pate was invited to be part of this event, but I am here on my personal capacity as Minister of State for Health and Social Welfare, and everything I say here should be 100% ascribed to me. Let me also say that when I received the invitation to attend this event from Professor Imran, I've always known that obstetricians are very persuasive, but he was particularly persuasive. And he now dropped the name of my teacher, former minister, and I knew that I just have to prioritize and be here. Otherwise, you know, once your teacher, always your teacher. Before you write that MGCN should query my certificate, so I have to be here. So it is a delight for me to join this epoch-making event put together to showcase the impact of translational medical research on quality of care, innovation, and improved healthcare delivery, particularly in cancer prevention and treatment. Let me begin by expressing my sincere commendation to the leadership of the HPV Consortium, the College of Medicine, University of Ibadan, and the University College Hospital Ibadan for this historic event. The University of Ibadan, the parents for all of this, also deserve commendation for providing the nutritional environment for translational research to flourish and ultimately promoting public health in our country. As the Minister of State for Health and Social Welfare, one of the key portfolios under my supervision is cancer prevention, treatment, and control. I am therefore excited to be part of this collaborative initiative designed to build long-term partnership and grassroots penetration using multi-pronged approaches of vaccination, screening, early treatment to address the high burden of cervical cancer in Nigeria. My presence here is to affirm that we believe in what you are doing as HPV Consortium, and to also underscore the importance of prevention in the fight against diseases of public health importance like cervical cancer. It's also an opportunity to showcase the good things that is happening in our institutions. A lot of time, we only get to read about the bad things. But the fact of the matter is a lot of good things are happening, and we must continue, we must be frontal in showcasing some of these very positive developments that is happening in our institutions, in our teaching hospitals, in our universities. I commend the multidisciplinary and cross-cutting membership of the consortium involving experts in clinical medicine and dentistry, public health, sociology, and humanities, as well as representatives of the federal and state government agencies and its parastatals. It's also noteworthy to see the robust handshake between this consortium and the Cervical Cancer Elimination Task Force of the Ministry of Health and Social Welfare, ably led by Professor Adewale. Distinguished ladies and gentlemen, as most of us are aware, the global burden of cancer is substantial and it is growing, with millions of new cases and deaths occurring annually. In 2022 alone, there were an estimated 20 million new cancer cases and 9.7 million deaths. Lung cancer, breast cancer, cervical and colorectal cancer are known to be among the most common types in both men and women, with cancer burden disparities existing across different regions and socioeconomic groups. The reality is that low and middle income countries, including Nigeria, are faced with a disproportionate share of cancer burden. More specifically, cancers associated with infectious agents have been found to contribute significantly to global cancer burden, representing roughly 13% of global cancer cases. The prevalence of infection-related cancers also disproportionately affects low and medium income countries, many of them in sub-Saharan Africa, where factors such as inadequate healthcare infrastructure and limited access to vaccination programs exacerbate the issue. In low and medium income countries, nearly 20 to 30% of all cancer cases are associated with HPV, especially cervical, anal, oral, and orovaginal cancers. Evidence suggests that Nigeria has one of the highest HPV infection in the world, especially among sexually active population, and it also harbors high burden of HPV-associated cancers in the general key affected population. Nigeria alone accounts for nearly half of all reported cervical cancers, 62.6% of anal cancer, and 56% of all oral and orophageal cancers among the 16 West African countries. On another front, our national prevalence of 1.4% in the general population is the first highest national burden of HIV worldwide. This scenario is an additional risk burden, as women living with HIV have a 6-time risk of HPV infection, which could progress to cervical cancer. HIV care and treatment programs offer a critical prevention opportunity to these women with screening and treatment for precancerous lesions. Nigeria contributes significantly to the global burden of cervical cancer, with incidence of about 18.4 per 100,000 women, and an estimated 12,075 women diagnosed every year. This makes cervical cancer the second leading cause of female cancer death in Nigeria. The inequitable distribution of cervical cancer cases and deaths is directly linked to disparities in access to secondary prevention. This grim reality, alongside the urgency to protect the health and dignity of over 60 million girls and women aged 15 years and above who are at risk, necessitated the implementation of a multi-pronged, multi-sectorial, and across-society efforts to operationalize Nigeria's response in alignment with the WHO 90-70-90 target for cervical cancer elimination by 2030. Ladies and gentlemen, Nigeria government, under the leadership of His Excellency, President Bola Ahmed Tinubu, GCFR, is giving priority attention to cancer prevention, cancer treatment, and control. We are providing primary and secondary prevention services and expanding treatment infrastructure for comprehensive treatment of cancer cases in the country. As part of primary prevention strategy for cervical cancer, we launched the most ambitious cancer prevention program through the introduction of HPV vaccination to our routine immunization program in Nigeria in 2023. Led by Her Excellency, the First Lady of Nigeria, Senator Oluremi Tinubu, CON, we have today vaccinated more than 14 million girls with HPV vaccine. We have also established a national task force on cervical cancer elimination in Nigeria, chaired by a former Minister of Health, who incidentally is also a member of this HPV consortium. The partnership, earlier this year in June, the task force launched the Partnership for Cervical Cancer Elimination in Nigeria to accelerate the effort to eliminate cervical cancer by 2030. And through NICRAT, we have developed and we are implementing the National Strategic Cancer Control Plan 2023 to 2027 with priorities focusing on cervical cancer screening, early detection as a national health objective. Under the Renew Hope agenda, 6 cancer centers of excellence are being established, one per geopolitical zone, to provide comprehensive cancer prevention services, diagnosis, and treatment. 3 of these centers are now ready for commissioning, while the remaining will be commissioned on or before February 2026. In addition to the 6 cancer centers of excellence, 7 other federal centers are offering oncology services across the country. We intend to sustain this initiative throughout the last span of this administration. And in the 2025 appropriation, our plan is to upgrade additional 6 federal institutions to oncology centers of excellence so that before 2030, every part of this country will have been equipped to treat all forms of cancer. This is our unique strategy to deliver on WHO's target of eliminating cervical cancer by 2030 and address the challenges of other cancers in our country. In order to reduce financial hardship for cancer treatment, the federal government continues to appropriate resources to sustain the Cancer Health Fund, which is also being implemented here in UCH, while also working towards a unique approach using the Basic Healthcare Provision Fund and other mechanisms to create a catastrophic health insurance fund in order to support patients with cancers and other finance-intensive chronic diseases. We have also reconstituted and reorganized the Nigerian Nuclear Medicine Technical Working Group to enhance our capacity as a country for cancer staging, treatment planning, response monitoring, and recurrence detection. Ladies and gentlemen, we cannot overstate the importance of prevention in healthcare. Too many Nigerians continue to suffer and die from conditions that could have been prevented or managed if detected early. Lack of access due to financial constraints, distance, and poor connection to specialized facilities prevents timely care. The use of innovative strategies like the mobile truck clinic that could help bridge the gaps is therefore a welcome initiative. There is no doubt that using mobile truck clinic to bring essential screening services directly to the people, especially those in rural and underserved communities, will help us detect diseases like cervical and other cancers at an early stage and increase the chances of cure for cancer cases. It also helps us to screen for other non-communicable diseases such as hypertension and diabetes. This approach is pupil-oriented, cost-effective, and aligns with the national strategy to promote universal health coverage and integrate care into primary health care delivery system. I commend the John R. Flanagan Foundation in the United States for supporting the building and equipment of this mobile truck clinic for cervical screening in Nigeria through the collaboration between the Northwest University and College of Medicine, University of Ibadan. The groundbreaking of the mobile truck clinic, the HPV molecular laboratory, and the HPV multidisciplinary research hub is historic and commendable. These facilities are not just infrastructure, they are symbols of a new direction in how we deliver healthcare and conduct translational research. They represent a bold vision where academic knowledge is translated into practical community-level impact. It is a promise of greater access, early diagnosis, better treatment, and stronger partnership. Before I close this keynote address, let me once again congratulate the HPV Consortium for their outstanding contribution to public health research, particularly in the prevention, diagnosis, and control of HPV-associated diseases, And let me also use this opportunity to thank the Oyo State government through the Deputy Governor, and particularly the First Lady, for accepting to champion this cause for us in Nigeria. I am delighted that the HPV Consortium represents a unique and multidisciplinary collaboration housed within the College of University, housed within the College of Medicine and the University College Hospital, University of Ibadan, two institutions that have long served as pillars of excellence in medical research and clinical care across Nigeria and West Africa. I have been informed that the HPV Consortium is adopting a strategic approach to preventing HPV infections beyond cancer, cervical cancer, and also using a whole population perspective, investigating HPV infections across multiple anatomical sites, including oral, anal, vulvar, and penile, through community-based and high-risk group studies. This approach, no doubt, set the HPV Consortium apart, putting it on a trajectory of sustainable impact and positive outcomes. In closing, I once again congratulate everybody involved in making today's event a reality. This groundbreaking event is not just about brick and mortar. It's about breaking barriers to access, building hope, and paving way for a healthier future. I urge you all to continue to work together. Researchers, policymakers, health workers, non-governmental organizations, our development partners, our community members, and I most especially recognize our KBC. Thank you very much for joining us in this effort, survivors of cancer, and all stakeholders, so that we can eliminate cervical cancer as a public health problem in our country. Distinguished ladies and gentlemen, thank you for your attention, and God bless the Federal Republic of Nigeria.
Another round of applause for our Honorable Minister. Thank you very much, sir. Ladies and gentlemen, permit me to quickly make this announcement as we round off today's program. There is an introduction that I made earlier, but I think so many of us have mentioned it in passing, and we should maybe mention it a little bit more. When the former minister was speaking the other time, he said, what we are celebrating today has been conceived over 20-something years ago. I remember the cocktail yesterday. The former minister, Professor Adewale, was mentioned as one of the people who had this dream and has been dreaming about it for a long time. And on his shoulders, and the shoulder of another of our giants here, Professor Imran, has moved speedily. And using the words used yesterday, he's standing on their shoulders so that they could see him easily, or whether he could see the other things easily too. And one of those giants on whose shoulder he has risen is his mentor, who we want to recognize specially this afternoon. He's a father, a teacher, a former provost, one-time acting vice chancellor of the university, emeritus professor Oladosu Ojengbede, retired but still looking like under 40. You're welcome, sir. A round of applause for him. His shoulders are broad enough to seat Professor Muasin Bello, and I'm sure that he's not tired of carrying him just yet. You're welcome, sir. Ladies and gentlemen, I want to also announce that some of us have been given some access cards. And so immediately after we take the speech from His Excellency, the Governor of Oyo State, if you have the access card, you may please proceed to the mobile truck so that we do the ceremony at that point. If you do not have the access card, you're advised to please remain in the hall here as to be projected for all of us to see, because the truck cannot contain all of us, obviously. So please, if you don't have an access card, you have to remain here so that you continue viewing one, and also so that you can take your refreshments here. But for those with the access card, you don't need to wait for the refreshment. You will get your refreshment at the commissioning there. Thank you very much for your attention. So ladies and gentlemen, welcome with me this afternoon for his remarks, His Excellency, the sorry, sir. I think I'm in a hurry for that refreshment. That's the problem. When you hire an MC and you don't give him food on time, you'll be looking for how to close your program before the closing. Ladies and gentlemen, welcome with me. I will call him the celebrant of today, the lead for the HPV Consortium, as he gives his vote of thanks. Welcome, Professor Imran Mohsen Bello. A round of applause for him.
Excellency, the Governor of Oyo State, ably represented by the Deputy Governor, the Honorable Minister of State and Social Welfare, who is actually in charge of the cancer control in the country, the Honorable Speaker, the Chairman of State Advisory Board for the Mobile Truck Clinic, the Provost of the College of Medicine, and the Chief Medical Director of the University College Hospital. Our moderator and discussant. Moderator and discussant, indeed, my teachers. I want to start by saying that what is happening today is actually a reflection of a genuine team spirit and mentorship. I strongly believe that investment in education is something that is very important for national development. And Nigeria, if we do it well, we can attitude. The vision started many decades ago, as mentioned by Professor Adewale. But the real vision of today's event also started many months ago. How do we translate science into the community? You need government. And this is why the University of Ibadan partnered with the Oyo State Primary Healthcare Board, luckily with one of my friends, whom our paths crossed when we were doing housemanship together in 1999 to be precise. And that partnership resulted into what is happening today. I will like to thank His Excellency, the Governor of Oyo State, for the support we are witnessing today, because it is very rare to find two arms of government present at a health event, not necessarily a political event. And I was more delighted when I saw my brother passing some kind of resolution and getting nod of his members on some germane strategic action. Thank you so much. Honorable Minister, sir, I will say I intruded on you some weeks ago. We went to Abuja for something different. And we were just talking about this program. And somebody said, you can go and see him. I did not get appointment. And he said, tell him to come over. When I met him, a former secretary to the state government and head of service. And you believe with me, Your Excellency, that this is the right person who has administrative experience to help us manage it. Thank you so much, sir. I want to especially thank the person that we have been working with for about a year. Your Excellency and Honorable Minister, we started the development of this mobile truck from scratch. We designed the components from the beginning. We've been doing the meetings in the last 1 year. And this was built by a company in China. And I want to publicly recognize the person that linked us with this company and eventually ship it to Nigeria. Luis. Luis is from China. Thank you so much. And his friend, who is also a supporter and a business partner of Luis, the former director at NNPC, Dr. Rabiu Suleiman. Dr. Rabi is passionate. He's saying we should have a repeat of this in Kano because he's from Kano State. I want to especially thank my teachers that are here, colleagues, students, because human papilloma virus cut across all ages, and it is something that we should talk about. I want to especially thank the media team. They have been very fantastic. We have been leveraging on their platform at practically no cost. And I must say that this is just the beginning of our effort. We promise to continue to engage with the public. On a final note, I want to say that all my mentors that are here, I want to thank them, including but not limited to Emeritus Professor Oladusho Jengbede and Professor Isaac Adewale one time. So, Your Honorable Minister, as we proceed, because I know you have a very tight schedule, been following up with your team. After the speech of His Excellency, we'll proceed to the truck. We will have a tour of that truck, and thereafter, we will go to the Institute of Child Health, which is 3 minutes walk to where the truck is parked, so that you can see for yourself. I dare say the first HPV-specific molecular lab in the country. And the team have started reaping the effort, because last year at Edinburgh, our team presented the first data on the epidemiology of HPV in men in the whole of West Africa. And this has also brought up opportunity for us. Last 2 weeks ago when I came to see you, we were asked to come and speak at the African Health Business Forum, because everybody thought HPV is just for women. But we now know that HPV can cause penile cancer, it can cause oral cancer, it can cause anal cancer. In fact, the Center for Disease Control, in about 6 weeks ago, had a breaking news that it can cause viral myocarditis. And I've started talking to some of our cardiologists that we will need to look into it. And last but not the least, I thank everyone for spending a quality time for us today. We appreciate you. God bless.
A big round of applause for him. Ladies and gentlemen, I've succeeded in not showing you my specialty of medicine this afternoon, which is that I should actually be putting everybody to sleep as we are here. But on the contrary, everybody seems awake. So maybe I need some more training in my chosen specialty. Ladies and gentlemen, welcome with me to give his remarks, His Excellency, the Executive Governor of Oyo State, Engineer Seyi Makinde FNSE, ably represented by His Excellency Barrister Adebayo Lawal, the Deputy Governor.
May we please be seated? Thank you very much. Well, let me first of all tender an unreserved apology for His Excellency for not being here this afternoon because currently is otherwise engaged on national assignment in Abuja, and also I myself, I think I came late by about 15 minutes. It's not my practice to attend programs late, but 3 hours before the commencement of this program, the executive secretary was in my house to inform me that the governor would not be around for this program and that I should take up the responsibility. So I've had to really rearrange my programs to really accommodate this event. If I were to be elsewhere, I probably would regret it because my knowledge about cancer, particularly cervical cancer, is much enriched. And I would tell you, on behalf of His Excellency, the Governor of Oyo State, that I will be one of the advocates for this program. The Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adekunle Salako, actually, about 4 or 5 days ago, he and I met at a function. So when I came to meet him this afternoon, I didn't realize that we met. And I said, you were not in that function. He said, no, you have forgotten that we sat next to each other at that particular function. I have to appreciate him most profoundly because as the person who moved the vote of thanks informed, to really occupy such an important position at the national level comes along with so many engagements. And for him to spare time to be here today, not only you should appreciate him, I think Oyo State government appreciate him as well. And the Vice Chancellor represented the Honorable Minister for Education. I have to appreciate him as well. Right Honorable Speaker of your State House of Assembly, I cast a joke. His dad passed on here at UCH. I'm aware of that. And each time we have had an occasion to discuss cancer, he would tell me, Excellency Deputy Governor, you know my dad died of cancer. Also 2 years back, his mom also passed on due to cancer. So if you want to really ask questions about cancer, I think don't go to anybody else, go to the Right Honorable Speaker of Oyo State House of Assembly, Right Honorable Debo Ogundoyin. You are duly recognized on this occasion. The former Minister of Health, Professor Isaac Adewale, who also is one of board members of this program, you are duly also recognized. We have Honorable Biodun Awoleye, Chairman of your State Primary Health Care Board here. You are recognized. And of course, I think it was the person, the professor who moved the vote of thanks. He said, this is not a political gathering, but you cannot stop me from recognizing politicians that are here. So all political office holders that are here, you are duly recognized. And the former secretaries to Oyo State government, Chief BC Adeshola, a brother indeed. And as Baba is walking up and down, just a while ago we celebrated his 80th birthday. So we have our royal fathers here, Kábíyèsí, a kí yín lọ́pọ̀lọpọ̀, adé apẹ́ lórí o, èròkè á di òkè ní mọ́ yín lọ́wọ́ o, nínú àlàáfíà ara. When the Provost, College of Medicine, University of Ibadan, Professor Temidayo Ogundiran, also the Chief Medical Director, University of Ibadan, Professor Jesse Abiodun Otegbayo. Of course, the Director Center for Global Oncology, Professor Lifan Hao. Thank you very much. The Deputy Provost, College of Medicine, University of Ibadan, Professor Samuel Olaleye, you are duly recognized. And of course, the Chairman, Medical Advisory Committee, University College Hospital, Ibadan, Professor Olubukola Adeponle Adeshina. The Deputy Registrar and Secretary to College, University of Ibadan, Mr. Adetunji Odedele. The Executive Secretary, Primary Health Board, Dr. Muhyiddin Adetunji, you are recognized. Actually, he was the one who ran to my house this morning to give me a notice shorter than 3 hours. Nevertheless, we have to honor this event. Thank you also. Well, all members of HPV Consortium here present, and all health family here, eminent personalities, our students from various secondary and tertiary institutions present here. You are welcome. You are recognized. I do not know how to salute students, but somebody did that on behalf of all of us. If it were comrades, we would say he is a little, but they are not comrades here. And so, good students, great students, thank you very much. Essentially, this program is for you because they are up and coming, and they must be well educated. Young ladies, young girls about cervical cancer. Gentlemen of the press, distinguished ladies and gentlemen. Well, from the beginning, let me appreciate the anchors of this program, and because the initiative would directly impact our people, our citizens, our girls, our women around here, and for choosing University of Ibadan as a starting point for the initiative. I think we need to appreciate them on behalf of the good people of Oyo State and the government of Oyo State. Furthermore, and because of the list of protocol they gave to me, well, which does not include our man from Kano, a friend to the Chinese manufacturers of the facility. You are highly, highly recognized. So it's a thing of joy for all of us this afternoon, because if this program were to be happening elsewhere, then University of Ibadan will not be University of Ibadan anymore. But that it is happening here, and the first of its kind in Nigeria shows clearly that University of Ibadan is still first. So, and as a proud alumnus of the University of Ibadan, I say kudos to all of you. Now, this is the speech of His Excellency, the Governor of Oyo State. He asked me to deliver a speech, which I must do. All of that is because I'm a friend of the university and then a lover of good health in Nigeria. So it is with great pleasure and deep sense of purpose that I stand before you today at this flag-off ceremony of all-purpose built mobile van for mobile cancer screening project, an initiative by Human HPV Consortium, College of Medicine, University of Ibadan, in partnership with our very own Oyo State Primary Health Care Board. Today is more than just commissioning of a van. It's a bold step in our collective commitment to ensuring equitable access to life-saving health services, particularly for the women and underserved populations across our state. As we are all aware, cancer generally is increasingly becoming a common cause of death, and research has shown that it might become the #1 killer in low and middle income countries, including Nigeria, by year 2030, if adequate investment in prevention and early treatment is not taken as an urgent priority. I believe this is one of the steps that we need to take so that this research finding might not crystallize or manifest. So the changing demographics of our people, occasioned by lifestyle changes such as smoking, poor eating habits, and increasing reports of changing sexual risk behaviors could be a trigger for the cancer epidemic. There are a plethora of evidence that cervical and breast cancers are the most common in women, while prostate cancer is the most common in men. Distinguished ladies and gentlemen, I am aware that the best solution to taming the scourge of cancer generally is health promotion and other prevention strategies, which include, but not limited to, self-discipline of food we eat, exercise, avoidance of harmful practices such as smoking, alcohol intake, as well as safe sexual practices. In addition, some cancers such as cervical, oral, throat, anal, could be prevented through HPV vaccination. Establishment of screening services help to detect early cancer that can easily be treated and cured. It is therefore unacceptable that ignorance, fear, stigma, and lack of access to healthcare services continue to claim the lives of women and men. And let me pause shortly. When Professor Isaac Adewale at the interaction was given a question about stigma. It's a major challenge, especially around us here. People do not yield themselves for screening easily because of stigmatization. And we need to do a lot more to sensitize our young men, women, girls, that they must yield to investigation, to screening, so that cervical cancer can easily be prevented. And I thank Professor Adewale for that positive response. It's not limited to cervical cancer. Generally, some diseases that could easily be treated without much ado because of a cultural stigmatization, people don't want to come out. So this engagement will further promote awareness in our young girls and women to really go for screening, because once we have these facilities, as we are about to go and inspect, such facility can help without much interference by human beings. So, Professor Adewale, thank you very much for that response. I want to especially appreciate HPV Consortium, College of Medicine, University of Ibadan, the Northwestern University, Chicago, and the John R. Flanagan Charitable Foundation, Chicago, for providing an innovative platform to provide access to cancer control in Oyo State, Nigeria. Using mobile struck as a clinic is highly innovative and it has the potential to bypass some of the challenges to access health by people living far from a specialized health care center. And I understand that this mobile truck clinic, MTC project, is fully equipped with its own water and electricity supply, changing and sampling room, diagnostic laboratory, and mini theater for treatment. So it's as those who spoke before alluded, it's a one-stop shop for medical treatment in relation to cancer, particularly cervical cancer. So we want to sincerely appreciate Professor Lee Fang Hao from the Northwestern University and Professor Imran Oludare Morasin Bello for leading this noble project. We equally thank other members, including the former Minister of Health, Professor Isaac Adewale, and Professor Robert Murphy from Northwestern University, Chicago. We want to appreciate the State Advisory Board members for this project chaired by Chief B.C. Adeshola, a former secretary to the state government of Oyo State, and also head of service, Chief Adeshola, and well, is one of the few civil servants who became a head of service and at the same time succeeded to be a secretary to state government of Oyo State. I cannot remember any other civil servant who wears such a double cap. So thank you very much, sir. Now, going back to this mobile unit, it is not a vehicle. It's not a truck that runs around our environment, our streets. It's a symbol of hope, progress, health, and even equity, equipped with modern diagnostic tools. This mobile truck will traverse our towns and villages, offering free and accessible cancer screening services, particularly for cervical and breast cancer. It will bring health services close to our people rather than waiting for people to find them out. In other words, I mean, this is a giant step in the direction of making health available, accessible to our teeming population who needs health care delivery, rather than staying around here within the hospital waiting for people to come. This vehicle will move around marketplaces, sports, to deliver robust health care to our people. And let me, because of this, commend HPV Consortium for its forward-thinking vision and its dedication to this cause. Your collaboration with Oyo State government underscores the power of partnership in driving sustainable health outcomes. We applaud our primary health care board for their coordination and readiness to deploy these mobile services across the state's primary care network. On this morning, when the executive secretary, primary health care board, came to my house, and he said to me that 4 locations or 4 local governments have been earmarked for takeoff. So I challenge him to say that, okay, you help plead with the drivers of this initiative to spread to other local governments in Oyo State. This is important because in the rural communities where the services are most needed, if we go on just one vehicle, in turn, it may not get to some particular local government, especially in Oyo North District, or Ogbomoso, or Ibarapa, in 2 years. So my appeal on behalf of good people of Oyo State is for this, the initiators of this program to be kind enough to make the facilities available to other parts of Oyo State. And I need also to say that our administration remains steadfast in its vision of a healthier Oyo State, because over the past years, we have invested in revitalizing our primary health care, training healthcare workers, expanding access to immunization, maternal and child health care services, and improving health financing. This initiative aligns perfectly with our broader strategy of community-based care, healthcare, and disease prevention. This journey ahead still requires our joint effort, community leaders, civil society organizations, healthcare professionals, and indeed, every one of us, because awareness must go hand in hand with access. And I think eloquently, this was addressed this afternoon. It's not just awareness alone, but access to the facility. And we must continue to educate our people, especially women, on the importance of early early detection, regular screening, and follow-up care. Our government will work to strengthen policies and programs just like these that aims to eliminate cervical cancer as a public health problem in our state. This government is open to further collaborations with local and international partners, community leaders, religious institutions, and private sector to expand the reach and sustainability of this first of its kind initiative. The purpose-built mobile clinic truck, as we will shortly see, is unique in many ramifications. I've alluded to such, and people who spoke before have also alluded to the uniqueness of this mobile truck. So as we officially flag off this mobile cancer screening van today, I call on all stakeholders to ensure its optimal use, maintain it, and keep the spirit of this project alive across every corner of our state. Together, we can drastically reduce the burden of cervical cancer and other preventable diseases in Oyo State. And together, we will build a healthier, stronger, and more resilient society. So on this note, we have not got to the facility, but since all of us are here, and then a professor who moved the vote of thanks said some will be seated here, others will be privileged to have the access card, So let me, on behalf of His Excellency, the Governor of Oyo State, Engineer Seyi Makinde, flag off the mobile cancer screening van for deployment across Oyo State, but starting with the 4 local government areas of Oyo State as pilot. So I have alluded to that earlier on. Spread it across, but we are limiting for the purpose of flagging up to 4 local government. Thank you very much, and God bless you. Thank you.
Thank you very much. Thank you very much. For those of us that have the access card, please proceed to the truck. Permit me to also appreciate all staff of the APP Consortium, all our vendors, all our contractors who have been working tirelessly in the last 1 year. Ladies and gentlemen, thank you all for coming, and God bless you all. So if you don't have your card, please wait here for your refreshment and continuous viewing. The ushers will lead us with the access card to the truck now so that we can do the commissioning, as will be led by His Excellencies, the Governor of Oyo State and the Honorable Minister of State for Health. Please kindly let's make way for them as they make their way to the mobile truck. And again, if you don't have your card, kindly remain seated here so that you can wash and also receive your refreshment. Thank you all, and God bless you.
Where is Lupin?
Purpose.
Okay. Yes, only Excellency, the representative of the government, the deputy governor of Oyo State, the honorable minister of state, social welfare, chairman of state advisory board, secretary, the provost, the college of medicine, chief medical director, the executive secretary of Oyo State Primary Health Board, members of national authority, because sometimes also I'm not on that here. This is one of the 3 events that they want to launch today. If you look at your backside, this is a mobile tent where participants are supposed to be stationed preparatory to the beginning of mobile talk presentation. So it was conceived that this mobile talk can go to anywhere where there are no buildings. The essence is that how do we provide equitable access to healthcare delivery? So on that assumption, our assumption is that let us assume we're in the desert where there's no building, that people living there. So this treatment, one is where people will first converge. Second tent, we act as a consultation to ensure confidentiality. Briefly on this talk, Professor Li Fang Hao and our team connected with a family, Platinum Foundation, the Platinum Foundation in the United States, through advocacy, because it's also a public health institution. Now, most say, sir, fairly sit on the moonshot advisory to the President of the United States. He has served 2 presidents. He's currently on the 2nd one now. So through that connection across the table, the individual donated over a work of days. And we have tried this pilot in 2 locations in Ibadan. We have gone to Ikare, Saturday, to recruit 10 patients. All of them were negative. But we also went to Yemeti, and we know Yemeti is an urban slum area. Out of 14 people that were screened, we found 6 of them to have high-risk HPV. 5 of them were treated with thermal ablation on the spot. And these are people that came to the PAC center to just say, I'm coming for hypertension, I'm coming because they do not know the happening in life-changing problem. They were treated here. Now, as this truck is moving through the streets of Unity in Ibadan, what we noticed that men were tracking this truck, and there was a question: what are you going to do for us? Of course, we are prepared for them. We have dedicated nurses and staff trained on how to measure blood pressure. So three of our colleagues here trained everybody on cardiopulmonary resuscitation, including the driver, Mr. Abis. All of them are certified, and I must publicly thank the trial of Dr. Oga, Dr. Ajay, and of course Dr. Adebayo, our MC. They are certified basic life support. Now, as you cut the rating, sir, we will move into the truck to look at the sampling room, sir. We can walk in. There is College of Medicine, but we are going to implement it in your state primary study. So we have started, maybe I should finish about this one. So, I think I want to know whether it's College of Medicine that we do custodian or other state government. What we are doing what is going to happen, sir, is that what we got from the donor is that we should implement it in partnership. So it is the custodian of the University of Italy. But it's going to be, because an implementation research, what we are doing is that it can be done. And by the time I'm telling you the cost implications, something the state government can buy at least in one of the senatorial districts. Because, like I told you, sir, Professor Lifrankau, myself, and other members of the team designed this truck from the scratch. So we know the cost. And without any addition or any 10% on it, is something we state government can buy three immediately, and then you have one in top of the Yes, sir. Yes, sir. Now, inside this structure, we have a self-sampling room. Self-sampling room is to bypass the problem of healthcare workers. So a woman can test herself at home, take the swab, take the sample by herself, send it to us or while the truck is on the way. Second is that we have a laboratory. We display it to you where test is done. Then the third is where the treatment is. And then inside it, we also have an ultrasound. And in case anybody has an attack, we have a defibrillator to reverse. Let us see. Okay, so on behalf of the government and good people of Oyo State and the University College Hospital, that I hereby declare this facility open. Yes. Let's get down. No, one is okay. I'm still one is okay. One is okay. One is okay. But it's one of the next thing. Yeah, one is okay.
I'm showing their finish. So allow me. Allow him. Your head.
Before things is okay, we're looking at the result, whether you have highly HPV or not. Machine is about. Incidentally, I was young and shared research and innovation, setting up by the National Task Force for Innovation and Startup.
No, that's not allowed it. But there's no space in front. Maybe you have space in front, but there's no. I think I've entered. Yes, I was telling them that I want to argue. Okay. Thank you, sir. If somebody has a has used machine. That ECG machine can run immediately. Now, Your Excellency, we have liberalized it. If you go to any cancer unit, they have big machine, they will say they want to do proposal. Well, that proposal is at the neck of the unit. Then they will say, oh, come back 2 days later. Or we have sent your picture to somebody abroad to look at it. Now, then, somebody can call you. And the other ones that take many months. I mean, many months. And it's charging you back. You don't know the electricity.
not a replacement of chemotherapy. So what usually happens is cancer and that virus takes 10 to 20 years to develop into that years. That's what you call cancer. That pre-cancer means it's like my dad is wearing now. You have some tests there. You will see that is about to change. Or when the plants is getting old, you say, oh, actually, you think kind of now, when you see that pre-cancer and you treat that person and be cured for not having it. So we're leveraging on that 10 to 20 years that many people don't even know they have. Five people I told you yesterday. Those were there. Now, one of them came, then he woke up. Just feeling from my life. Doesn't even have them. And then one of them came to come and greet me. Most seamless type was cancer. Treated. So she was just standing there to say, I say I want to come and treat you. Why did you pick my call? Why did you say I should come? If I had refused, what would have happened to me? So, and then these are the materials. Have a fridge. Basically, now don't take those samples back. And then, of course, the room is clear. And then, if somebody has a lump on the breast, lay it here, kidney surgery. Yes. Because we're buying structure, for the equipment, and then of course the training of the staff, all these things. But it has a solar panel, the inverter is there. Now, because we know there is going to be a crowd there, we took the ventilator based on the plans. You need to take over the respiration of that. And from my room, let's assume somebody collapsed there. And take over the breathing of that person. Come to my friend. And then play out. That's
about that because you don't go home regularly. Let me just before you can still do it from before they go to the job. There you go. I said that they need services. By the economy, I would ability. I would like if I focusing locally and essentially quite a number of things you can remove from there. Bring down because it's important that it's important for you government ability and I also believe that you bring it down into the size of this and access to areas that are very bad. I imagine that you don't have steps for if there are no tests. So, my campaign so and line example possible for you to even have this. Can you design a box that we can train community health workers that can go communities directly? That will take feeling. Yeah. So that is only that. There is a program to president or people and the essence of take intervention
Yeah, talk. No, now. You want me to become invisible just like that? Hmm. Yes. Huh? Oh, he's already there. What's up with you? Mike. Okay. You need to say. Yeah. Yes, sir.
Okay, sir. This is the HPV, one of the HPV Research Consortium office. This office was built from scratch, and I think I will allow our provost to say something about it. Well,
Building is called health. national child health institute college of medicine. And it's a place that houses many units, college, charge of pediatric children, adults, women, and other parts of the university. And this building, this place especially, was given to our PI here for this purpose. So he spent all the money to make sure that this place becomes what it is today. Not only that, part of the project was to renovate some parts of this building, including the rooms, electrical activities, and all that. So it's a blessing, not just only to your state, but also to the college. And we wish him well in this end.
Well, I know your Almighty God too. Nigerians, especially people in Oyo State, I want to thank you. Commission this Consortium start from I think we should just allow me. Let's go to the one. Thank you, sir.
This is where we'll be storing all the samples that we collect, and this has facilities to store 300,000 samples. And then it is solar powered, and then this is the laboratory. Laboratories. Now this is biometric. You have to register before you can open. This is not to open. So this is the molecular laboratory. Yes. No, it's another money organization for this. This is the equipment that we use for different type of HPV. That's why I'm saying that this is probably the first in the country. So here, this is the PCR machine where we do a lot of DNA extraction, like this machine, and extract DNA and RNA by itself without using manual. So this is an automated system. DNA, yes, we can. Yes, sir. Yes. Yes, sir. And then this is a workstation. Yes, this is the head of our lab. Our lab. Thank you very much, sir. Yes, we have the extraction. This is where we do the mix. That's for the reagent. And like Iradi said, both for RNA or DNA, that is where we amplify. That's the popular artisanal machine there, which is the RT-PCR, one the read and everything. And this is where we have the sequencing facility. So the whole of this is what we call the molecular virology. So we have our open laboratory where we do with ELISA, dynamic assay, immunochemistry, immunology, Rest. Thank you so much, sir, Your Excellency. No, we cannot rest there.
Okay. Let's go.